Alright, we're going to go ahead and get started. I'd like to introduce to you Dr. Jordan Hanson Utley. She's a certified athletic trainer who gained her PhD in experimental psychology, where she implemented various cognitive interventions with nearly 100 athletes, rehabilitating from sport injury. She has worked with the athletes from all levels, including United States men's and women's soccer teams, Olympic athletes at the Olympic Training Center in Colorado Springs. Jordan is an assistant professor and program director of an undergraduate athletic training program at Weber State University in Ogden, Utah, where she continues her research on the use of effectiveness of psychological techniques to augment the injury rehabilitation process. Hello. Is that okay for a tone? Okay. Today I'm going to talk to you about the usefulness of various psychological scripts. Last year I spoke about the educational venues, avenues, things like that, how to deliver the material to individuals. And this year we're going to talk a little bit about the effectiveness of various types of scripts and when to use those scripts. So sort of the what and the when. We'll cover those today. This is a little bit of a review for those of you who know a little bit about the topic. Each athlete, when they're injured, responds to psychologically different to the injury. So when the body is injured, the mind is injured alongside the body. That psychological injury is what we're trying to encapsulate into something that makes sense and figure out how we're going to aid the athlete in experiencing that injury. With a negative appraisal of an injury situation, that's going to affect the entire rehabilitation of the injury. So they'll go into the injury and negative self-talk, negative outlook, and it will be more than likely difficult than it would if they're viewing it in a positive nature. Also with injury, if an athlete does not have coping skills developed, so coming into the situation with a set of coping skills, maybe a history of being injured before, injury itself as a stressor can overcome their ability to cope. They don't have the coping skills in place to be able to handle that situation, and that can be disastrous. Personal and situational factors also play in. I mentioned history of injury, also personality of the athlete, and situational factors, which we'll take a look at a model in a second. But just thinking about a field, time and season, if a Butler athlete was to get injured right before the final NCAA game, how different is that versus an injury in preseason for that same athlete? So time and season affects how the athlete appraises their injury process. So the cognitive appraisal model, we'll take a look at it quickly. Pre-injury factors are at the top here. Right up here. So we have history, personality, coping resources that the athlete brings to the table. And then interventions that athlete has used already, positive self-talk, relaxation, cognitive restructuring, mental imagery techniques, the things that they've already used that they bring into the situation. These things, as well as personal characteristics, I guess I have to point over here instead of here, and situational factors, time and season, are they a starter? Are they a bench? Are they sixth man? Where are they on the roster? These things all play into how they look at their injury. Another thing that I've done research on that I want to point out is pain tolerance. That's over here. That's an individual characteristic. And the research shows that individuals with lower pain tolerance have a more difficult time progressing to rehabilitation. I think we would all shake our heads in agreement with that. It makes sense. So how do we help that athlete with their pain tolerance? That's where psychology comes in. So all of these factors play into how the athlete appraises their injury as positive or negative. And let me give you an example. So a United States soccer athlete, I won't name any names, who's had many injuries, tears her ACL. And she comes to me and she says, okay, what are we going to do? What's the plan? Who am I going to see? And how is this going to unfold? Versus a freshman who's come to the national team for the first time and tears her ACL. And she's in tears. She's on the table in tears. She says, I'm competing for a spot and now my life is over. So that gives you an idea or an example of a cognitive appraisal taking place or unfolding right in front of your eyes. So that has an effect on their recovery as well. So why do we research it? Why am I interested in researching this topic? I think the body of literature out there right now effectively communicates to you as a practicing clinician that the mind is injured alongside the body. So it's something that we need to address. And that negative responses sort of impede the progress of the athlete. And we don't want to do that. We want to optimize the environment for them to progress. So this is my plan of 2010, is to encourage all of you to increase what you do in the psychological sector, in the psychological realm with your athletes. And one of those things that we currently do is goal setting, but we'll get to that. So why do we research these things? Why do I? To provide information for you on the effectiveness of various techniques. So not only, here's this example, I'm not going to tell you it works, but I'm going to show you the evidence that it does work. One of my graduate students here at the conference yesterday presented some of our slice of our data on relaxation scripts, showing that it does reduce cortisol levels. So that's the kind of thing that I want to present to you. Give you evidence, the objective markers for, not subjective, but objective. So we have plenty of subjective in the realm of psychology, and I think that's a challenge. Many times we'll ask athletes, how do you feel? That's a subjective piece of data. But let's get the physiological markers. So cortisol is one of those. So I mentioned goal setting, and this is interesting too, and I want to share this with you. A lot of us use it. Who considers it a psychological technique? It is a psychological technique. So when questioning physical therapists and athletic trainers on an 08 study that's in JAT, physical therapists didn't consider it a psychological technique either. When I was surveying on goal setting, mental imagery, positive self-talk, pain management strategies, it received the highest overall effectiveness rating from therapists, physical therapists and athletic trainers. So we use a highly effective technique. Number 2 and number 3 are techniques that we don't use so often, and that are rated by us as an athletic training body as less effective. And the research I presented last year from that same article suggests that potentially it's from education, how we're prepared to handle these, to utilize and implement these skills. So we'll mainly this talk will address number 2 and number 3. We already effectively used number 1. So intervention goal setting. The goal setting as an intervention rather. Athletes set this, the reason I include this slide is athletes use goal setting on a daily basis. They are very good at it for the most part, especially elite athletes. When the athletes are good at a skill, it's easy to transfer it into rehabilitation. Unlike positive self-talk, unlike mental imagery / relaxation, if they don't use it, it's going to be difficult now for us to say, let's use this. So goal setting we've utilized it, we're good at it. We can easily transfer that from performance into rehabilitation. So what does it do for us? It increases our adherence levels. It motivates us to continue with our rehabilitation. It also is a progress indicator, which is tied to motivation. So positive self-talk. How many people today woke up after Friday night and said, oh my gosh, I don't look so good in the mirror? And I've seen some people throughout the day that probably are feeling the results of last night. So the look on your face and how people react to you and what they say to you, how does that change how you feel about your current state? So if someone says, you don't look so well, and then you see a few more of your friends and they say, you're really white, you just don't look that well. What kind of an impact does it have on you? Just think about it right now. This is the effect of cognitive reframing or positive self-talk for the athlete. Think about a difficult rehabilitation exercise and what the athlete says to themselves as they're attempting it. Athletes want to conquer everything. That's their personality. So as this challenge faces them, and they cannot, or they're having a difficult time beating it or winning in their mind, negative thoughts, negative self-statements are a common result. So it's getting them to be aware of that and figuring out how we can change that. So what can positive self-talk do for us? Motivational, improving adherence, keeping us coming back to rehabilitation. As many of you know in the medical literature, adherence is a huge problem. keeping that athlete. Once they think that they're able to walk on their own, so to speak, they don't come back. And we know that they're not quite done. So adherence is an ongoing problem for us. And facilitating a faster recovery. So now is a good time to point this out. A lot of psychology practices get a bad rap, so to speak, because they claim to accelerate rehabilitation or recover faster. And I want to point out that what we're trying to do with these interventions is not speed the recovery, so to speak. It's to optimize the athlete's baseline, because they do so many things to themselves that lower their baseline. Does that make sense? They do so many things that impede their progress. They don't follow our safety guidelines. They don't take their prescribed medications when they should on a schedule that will keep it in therapeutic range. They don't follow directions, period, sometimes. And that harms their ability to heal. So all we're saying here is that using psychological techniques optimizes the healing rate to their personal set rate, makes it as fast as possible. Not some magical technique. So I wanted to make that clear. Mental imagery and relaxation. So these two are difficult to pull apart. My dissertation, I tried to do that, and it seems like every script I would approach or attempt to use would always have a relaxation precursor. It always use deep breathing or some type of a vocal technique that would gear the athlete to relax, focus on what was about to be delivered. That's relaxation in itself. Now, scripts can be engineered to be relaxation only. Those are great as well. But using mental imagery with athletes is very difficult to say, okay, Candace, start right now. She's focused on many things. She's thinking about what she had for lunch, she's thinking what she's doing later. So focusing the athlete is part of the relaxation process. So they go hand in hand. Different types of scripts, might be performance imagery, relaxation imagery, and healing imagery. And last year I shared a healing imagery script with you as an audience. If you're coming to the workshop later, we'll do quite a few different types of scripts. So what does imagery do for us? Imagery has been shown physiologically to reduce muscle spasm, increase circulation to the area through vasodilation, which are both helpful in healing process. Lower anxiety, which with anxiety comes muscle spasm. So those are all tied together. And then reduce pain. Increasing motivation, focus, and confidence in the athlete as a result of being in a relaxed state, focusing on the positives. Increasing adherence to our rehab as we focus on rehabilitation or performance imagery, focus on returning to play, as well as optimizing recovery speed, which I probably should change that to optimizing instead of increase. In order to examine the effectiveness of psychological scripts, we need to look at the phases of rehabilitation. So an athlete these phases are pretty universal throughout the literature. Phase 1 is initially following injury. So pre-injury, which quite a few individuals are working with, employing these techniques pre-surgical, rather, not pre-injury, pre-surgical. Phase 1 is really post-surgical, or immediately following, and the recovery starts. Their reaction to injury in phase 1. Phase 2 is really wrapped up in their reaction to rehabilitation. So we're moving on, they've accepted the injury or they're dealing with that. Now they're looking at the rehabilitation pathway. That's phase 2. In phase 3, we're preparing the athlete to return to play. So they're starting to work on speed, they're starting to work on agility, they're starting to work more into sport-specific things. So you can see how performance imagery fits nicely into this phase. So in phase 1, for each of these phases, I've outlined a couple of physiological and psychological markers. Physiologically, swelling, pain, and loss of function. And psychologically, managing their pain seems to be number 1. And remember on the model, pain tolerance is an individual characteristic that can strongly determine the behavioral outcome. So if we can manage the pain that they're having, more than likely that will help them. They'll want to come back. They'll be more positive in the rehabilitation process. And I ask my students this a lot. What exists in most physical therapy clinics? What's on the wall? bad question. That happens to me a lot too. So, what's a distraction? Television. There's a television in a lot of physical therapy clinics. Why do you think that's there? So that the therapists can stay up on the daily news? It's a distraction technique. Individuals are doing a prone hang, and we ask them, what channel do you want? It's a distraction technique. So we do utilize things that already occur in our environment for the athlete. However, think of the athlete who's laying there in a prone hang and in excruciating pain, that you're not talking to them. They're all by themselves. There's no one around them to talk to, and they're just sitting there. What are they thinking about? The pain. If you simply walk over there and engage in a conversation with them, you can divert their thought processes away from the pain. That's just another distraction technique. So pain is huge in phase one. Injury education is also a very important piece. And psychologically, think about not knowing too much about a trauma situation that you're in. Not knowing how to do CPR and you have someone who's lost a pulse. Versus knowing how to do CPR and you have someone who's lost a pulse. What's the anxiety level in those two situations? So educating the athlete on what to expect, what things are going to cause them pain more than likely, just a general guideline on this is the injury you have, and this is more than likely what unfolds. Giving them that information will lower the anxiety level. It's very important. Useful psychological skills on this stage, goal setting. Goal setting is useful throughout the phases of rehabilitation, so let's get that one out there and we won't readdress it. Positive self-talk. Facilitating adherence, getting them to start talking positive to themselves, learning how to rephrase comments as far as, I can't do this, I want to do this, or I can do this. Rephrasing things into a positive fashion. And managing their pain with positive self-talk as well. When athletes are having to increase their range of motion, it's very painful in phase one. The education plays a role here as well. If we tell them it's an okay pain, then they're able to move further. They're able to accept that pain and move through the range of motion. And it's not a damaging pain. So there's another highlight of how to use education. And imagery, useful in phase one, pain management, and healing imagery. Who's familiar with healing imagery? One, two, not very many. This is a technique that's been used with numerous cancer patients in numerous studies across the United States and beyond. And this is really using positive self-talk combined with positive restructuring and combining those to see yourself, kind of performance too, see yourself beating cancer, see the white cells, see all the cells, see the negative or the cancer cells being eaten by other cells, and really training the body to beat the cancer. There are many people who beat cancer holistically. So the studies that have been done on this are actually rather old. There are very few that are new. But it has been used in that way with cancer and other disease processes. With athletes, we typically use education, give them pictures of their injury and their recovery or their repair, their surgical repair, what that looks like. Through MRI slices, through x-rays, whatever we can get our hands on to build something for them. So that their anxiety lowers, they can see what they're dealing with inside their knee or joint. And then they can picture that joint instead of so common colors used here are red and blue. The red is pain, blue is a cool, healing sensation. I see a lot of heads nodding, so you're familiar with that. In these types of scripts, we have a lot of blue, a lot of cooling sensations, bringing nourishing things to the joint. This is sort of one of those periphery. Not a lot of people like to use it. They think it's a little bit pokey. But it's only as good as you make it. So if you believe that, it's going to be hard for you to make something effective for the athlete. So healing imagery is a script that you might be building last if you're working on making these for your athletes. It's a challenging one. So something that might be in a script that you create for your injured athlete in phase one. When we create scripts, oftentimes we use a standard intro and a standard conclusion, sort of get the athlete into a relaxation phase. Then we deliver our point, and then we bring them back to awareness at the end. And they can range in time from 5 minutes to 15 minutes, depending on when you're going to implement them. So think about how long you ice, whatever that is at your university, because it varies. So how long you ice, maybe you want to, or heat, build your script around that. When you know you have the athlete in a captive audience, you might want to use it and build the timeline around that. So some of the things you might include: notice how your body feels, note your pain, see your pain as a red globe surrounding your knee. Imagine that globe lifting, floating away from your knee. Excuse me. See your pain floating away with the red sphere. Notice your knee surrounded by a cool blue glow, absent of any pain sensation. So that gives you an idea of verbology, or what you would use, how you would build this script. Phase 2, physiologically, strength, balance, and agility. And psychologically, motivation and measuring progress, very important in stage 2. Useful skills here, goal setting, obviously, positive self-talk, motivating the athlete through difficult exercises. So in this case, if your athlete is struggling with cup pickups or vector dips or whatever, everyone calls them something a little different, a challenging exercise. Take pictures of that athlete doing that exercise. You ask them for what words mean power to you, what words mean strength. Get some power cues from them, get some words that mean that they're building strength and power. Combine those with your pictures. Ask them what's their favorite song, what song really gets them pumped up. Integrate these things and make them a little prep script for before rehabilitation. It's just an idea. And imagery, rehabilitation exercises, again, getting them to imagine. So in one case, you're giving a performance imagery where they're watching it. That might be an example. Or in another case, you might use relaxation if they're really getting frustrated and having them imagining themselves do it successfully. That would be another route. So you would lead them through that verbally, seeing themselves complete the exercise and getting back onto the field. So in phase 2, when they're dealing with these difficult exercises, oftentimes we have negative self-talk. So an example of that, just some affirmation statements. I will be successful today. I will complete all of my exercises at full effort. Oftentimes, I would like to have the athlete speak these and have myself record them, have them come into the sound booth and they will say these things. I think it's more effective for the athlete to talk to themselves versus myself, give them the cue. I have the determination to return to the field or court. I will work hard today to reach my goals. I choose to be here and I choose to endure anything that's given to me. I will become stronger today. I'm in control of my destiny and my success. So some positive statements for that athlete. You can use this after a hard rehabilitation session or as a routine. Before they come into rehab, they listen to this. Get them to focus on what their goal is. So phase 3, returning to play. Physiologically, some things we deal with here: scar tissue, setbacks, not reaching your percent function, or the athletes who do, and they're not mentally ready to go back. They develop malingering characteristics. All of a sudden they come down with a tendonitis of the elbow or something that's not unrelated to their ACL rehabilitation, or they're sick. They have migraine headaches that just uncharacteristic of that athlete. When those things happen, that should raise a red flag for you. And they're just about to return to play and all of a sudden they get sick. So be thinking about that. Yes, trust them. They may be sick. Examine it and see. But also think about what could be occurring here. Maybe we didn't bring the mental alongside the physical in our rehabilitation. Maybe they're nervous. Maybe they have anxiety about re-injury. If you didn't address psychology at all, more than likely that's what's happening. So psychologically, confidence, managing fear, and re-injury anxiety, those are the components you're dealing with in phase 3. Frustration might also be one if they're experiencing setbacks. They're not getting to that percent function that they need to return to play. So useful goal setting, positive self-talk, imagery, promoting confidence really is the main thing here. Getting them to see their joint performing as it was, stronger than before their injury, build the scripts that phrase their injury in that way or their recovery in that way. And then we can also do rehabilitation goal setting imagery, which I think is the next example I have. So your knee is strong and mobile. You've completed all exercises and everything that was required of you in your rehab. You will now take the field. You see yourself warming up, getting loose, feeling the flow. You see yourself competing, battling for the ball, and never giving up. Your knee remains strong as steel and moves effortlessly. You see yourself reaching for your rehabilitation goals, meeting your demands, and regaining your status in the field. So here we're having them focus on specific goals. You may give them 2 to 3 minutes to examine one specific goal, where you don't say anything to them. You give them time to reflect and pick a goal that's challenging and set some positive affirmations forward for that goal. Feel all of your success, feel the success of all of your hard work. So you could implement some breaks in here and have them cue certain goals. And this can be rather generic. You could make one and use it for every athlete that hits this phase and has some difficulty. Obviously, making one script versus making personal, individualized script, there's a difference there. But you can start with some generic resources. So I mentioned you can start. So who can implement these skills? Everyone here. Certified athletic trainers are trained professionals in this area. From the Katie Education Guidelines, the Psychosocial Intervention Referral Content area, at 15 competencies and 2 proficiencies that outline the psychology of sport injury participation. And the referral of things that we are beyond our role as a caretaker. So specifically, I jotted them down here if you want to look them up later. C1, C3, and C4 are specific to mental skills. Knowing how to use mental imagery, knowing how to use goal setting, knowing how to use self-talk and relaxation. So we got this education. Now my age group and beyond and behind me, I guess that would be, and forward, older than myself, and I'm 38. If you're older than me, you probably didn't get it very well. So it's really a challenge to my generation to go back and get the continuing education, because oftentimes we're educators of our students. And the attitudes and opinions we hold will affect what they do. There are 2 specific clinical proficiencies. One is the ability to interview and find out if we can pick out what this athlete needs. And the other is to select and integrate these skills into rehab. So specifically, our education trains us to do this. So who's qualified? It's you. If you work in a high school, if you work in a clinic, if you work in a college, it's you. So high school athletic trainers, up to the elite, everyone can use the skill. I have included some resources for you. If you have iTunes on your computer, I've posted, and there are more than 3 now, but I've posted a bunch of different scripts for you to get started if you want samples. There are some generic scripts up there you can use for relaxation. I think it will be a good help in maybe starting to use techniques, getting some feedback from your athletes on these techniques. If you up in the search box here, if you put Hampson Utley, or Dr. Hampson Utley, or Weber State University, all of those things should get it for you. And it will bring up this page on iTunes, and you will see all of these works down here. And you know what the great thing about it is? 99% are produced by our students. So they are getting firsthand experience in producing these types of interventions for injured athletes. And everyone can set up their own podcasting page too. It's very easy.